My first reaction was definitely, where am I going to take these sessions? Because the office that I would go to meet my therapist was that physical space that represented, like, here is a place that I can just talk and be my full self.
It's no secret the COVID-19 pandemic has had challenging effects on how we approach our everyday lives. From remote work to limited social interaction to job loss, difficult situations have raised new concerns about mental health.
I think people were grieving the loss of their normal life, their friendships, their relationships, their social events, their connections, their work, everything. It just felt like such a loss.
On the client side, collective feelings of stress, loneliness, and loss forced many people to confront their mental health concerns and take them more seriously.
COVID presented a lot of telehealth, like a lot of different access points for individuals, a lot of outlets for people to talk. And so now all of a sudden, everybody's in the same boat. And you can start to have a conversation that applies to all.
In response to this growing need for alternative mental health options, providers adapted their practices to accommodate virtual forms of care, creating new solutions for their patients.
All these new approaches, I think every therapist got very creative in their own ways. But for me, it was just like, as you're telling me about this event or this feeling, what are you doing with your feet? What are you doing in your seat? What are you doing with your hands? So I asked my clients to describe their body language to me.
The pandemic also raised the profile of existing virtual mental health options like Talkspace, an app that has specialized in virtual therapy since 2012. Services like Talkspace were able to serve new and current clients using a model that was already in place.
The structure that we really believed in and that we saw to be effective, as in virtual online care, we're so grateful that it was in place. And so that the volume of those people who engaged and who accessed services has really grown.
While many areas have been devastated by the pandemic, providers believe that when it comes to mental health, positive developments are outweighing the negative at both the industry and client levels.
From a care perspective, it's forced innovation into a space that was so slow to innovate. From an individual perspective, it's made people think long and hard about getting over the stigma and talking.